A lot of times, the type of people who run for political office are people who have a lot of ambition, but not a lot of passion. And you need ambition. I'm an ambitious person. You're an ambitious. We need ambitious people. But with the lack of real passion that is, connected to people that you're serving, that's where you can be corrupt.
I'm concerned. I mean, I'm glad you're on because I feel already that you are obviously someone in this for the change. And it can become very hard to think that our politicians don't hear what we're saying. And I do believe obviously we elect you. It's important that people realize that their vote matters and that if you want change, you got to vote for it in this country. You got to get to the polls, tell people the impact, and we're seeing the repercussions of it now. I mean, it's hard to see.
Look, my politics are simple. Like, I want you to live your best life. And I believe being in the richest country on the face of the earth, our government can do a better job of making sure that there is a line that we set. And we say as a government and as a people that because our country has immense wealth. Our country has immense wealth. We're such a large economy. We have so many resources. But we have to look at the way we prioritize things because we can, as a society, come together and say, this is our line. And we're going to say that no American will get below that line. And what's below that line? Homelessness, abject poverty, being hungry, not being healthy.
Welcome back to the show. If you are watching this, you are on my YouTube channel. And thank you because we finally reached 100,000 subscribers, that little plaque back there. And it means so much because I love being able to bring important information to all of you and have the most amazing guests who are not only affecting the lives of so many, but they're changing the world. And today is one of those people. I'm honored to have him on. Congressman Maxwell Frost, representing Central Florida in the United States Congress. But if you don't know who he has made history as the first member of Gen Z elected to Congress. And to put this in perspective, you're most likely a millennial or older because so am I. And he's brought his background as an organizer, activist, and musician into the halls of Washington. Inspired to act after the Sandy Hook shooting at just 15 years old, Congressman Frost has spent his life fighting to end gun violence and championing issues that shape families' daily lives, from affordable housing and healthcare to abortion rights, LGBTQ rights, and justice reform. And I'm so honored to have him here for a conversation about the future we're building for our kids. We're talking about public health, politics, and Gen Z leadership. Thank you so much, Congressman Frost, for taking time out of your busy day to be here today.
Yeah, thanks for having me on. I really appreciate it and excited for the conversation.
When we connected with your team, I was like, I gasped and I was like, oh my gosh, like they want to come on the show. This is going to be amazing. And you're honestly the second politician that I'm having on the show. The first one is Dr. Annie Andrews. She's a pediatrician in South Carolina running for Senate against Lindsey Graham. And for a long time, I didn't have politicians on my show. One, because no one would respond. Number two was because I didn't want it to be that I was aligning myself with one party or the other. But unfortunately, what's happened is that I'm a millennial, and I've said this before, but I've seen how much politics has shifted over the last few decades. Back in the 90s and early 2000s, under presidents like Bush or Reagan, public health wasn't so divided along party lines. Now it
Yeah.
feels like every health issue gets politicized. And as a pediatrician and a mom, this really concerns me. And as someone from a younger generation in Congress, how does this feel for you? Because I know we're also going to be talking about the removal of vaccine mandates in Florida, but do you see this in the same way? And what role do you think this new generation of leaders can play in changing this back to maybe what it used to be, politics?
Yeah, it's incredibly scary because I mean, you brought it up. For so long, there's a lot of things that would get politicized, but healthcare, vaccines, science wasn't really something that was that politicized, and
Yeah.
it's really dangerous. And I think this has happened for many different reasons. I think that the president and this movement that has come up on and it's not a problem to question the way things are, right? And I always
Right.
bring that up to people. I have friends that are in the Maha movement and different things like this who are very skeptical about things, and I always tell them it's not about not being skeptical. In fact, that's what science is, right? Is testing things, coming to the conversation with a healthy dose of skepticism, but it is a problem that then, when presented with evidence and research done by many different people from many different places, and there's a general consensus. If you then continue to cast doubt, to spread misinformation and
Yeah.
disinformation, then your skepticism is no longer skepticism, and it is now dangerous disinformation that can literally kill people. And
And
that's
yeah.
what we're in right now, and that's why it's so dangerous. I mean, I know we'll talk about the vaccines, but I the healthcare in this country right now is at risk. Our healthcare system was broken before this president. I'm not going to sit here and say we've had a perfect healthcare system. I believe we need to ensure that healthcare is a human right, not health
Yeah.
insurance, healthcare, the actual care, being healthy. Um, and I think the system we have isn't set up for that. It's really set up to make a few people very rich, and it doesn't take into account providers, patients, people, and healthcare. And I think that's really important. But what we're seeing is the system we do have, they are breaking it right now. From
Yeah.
the drastic cuts to Medicaid, to cuts to nutritional assistance, to adding this not just doubt, but disinformation into basic research, science, and vaccines from HHS. And I was actually just this morning at one of our federally qualified health centers, and I was speaking with the chief of medicine there, chief medical officer, about what is she hearing on the ground from predominantly low income families
Yeah.
on, are they asking questions about vaccines, are they asking questions about, are they questioning the doctors more when they say something, which is no problem to question, but what are you hearing? And what I heard is yes. And it's not just a healthy dose of skepticism, it is full distrust
Yeah.
coming straight from the government, which isn't really supposed to politicize medicine. And it's putting us in a place where it is more dangerous in this country. And we're seeing that many diseases have come back that really haven't really been around in a big way. And unfortunately, we'll see what happens with the vaccine mandate here in Florida, but it will probably get even worse. Hopefully not. And I asked her, how do you think we fix this? And I know you're interviewing me, but I'm curious to hear what you think too. Like, what do
Yeah.
we need to do as a society to get back to this point where we acknowledge that, I mean, there are facts, and the facts are true, and you don't mean you can't question stuff, but I talk to my colleagues about this all the time, who, especially ones that have been there for a long time, who are used to a politics where someone tells a lie, and then you go on the news and you set the record straight, you tell the
Hmm.
truth, and then that's all. But we're in a different society now where it's more of your truth versus my truth. The way we tell it and where we tell it will impact how many people believe it. And it sucks, but it also is. And I think it's something those of us who really want our society to of course, put that trust into basic research, experts and stuff like that, so we can keep our people safe. What do we do to get back there? And it's really important to me. It's part of the reason we reached out to come on the podcast
Yeah.
and speak with you and a lot of other creators and influencers, because more and more people are not getting their news from like journalists, but they're listening to different people on different places on the internet to understand a little bit more about what's going on. And I think it's really important that we're in those spaces as well. So sorry, that was a long answer,
Oh,
but
but I wrote you're lucky I'm a mom and that I have a good attention span because I have responses to all of those things. And so the first thing, I wanted to address was thank you for being a policymaker that understands the harm in politicizing healthcare. And I love that you talked about it as healthcare, not just having health insurance. Healthcare is a human right, and that I want to focus on that care term. You know,
yeah,
we from the healthcare perspective, and I've been practicing now for 10 years, residency for another 3, so 13 years in practicing medicine, right? I've been in 3 different areas of this country, and the common thread, like you said, is distrust, but the common thread from our angle, as a healthcare provider, is obviously lower reimbursement, less time with patients, high burnout rates, and lack of respect from the men in suits that run how we, they are taking control over how we run practices. So we're
Yeah,
not being able to practice our art of medicine. The reason why so many of us, especially general pediatricians, went into medicine is to truly impact lives and to answer that beautiful question that you have posed many times, to answer the why. And so when I went into pediatrics, it was because I love explaining the why. I love answering the why. But now when you have 10-minute visits and people have 10 questions, how can you answer the why in 10 minutes? And so part of this is recognizing that this is a huge disservice to our communities, not only in Florida, but nationwide. I don't care what socioeconomic bracket you have. If we don't have a solid healthcare system or in a solid education system, societies crumble. And that is where we're headed. And I'm seeing it now, how, living in a red state, because Florida is a red state, being on the more centrist liberal side of policy and living in a very blue area of Florida, in Broward, and seeing how this is now taking shape in terms of the education systems, things coming from the government, like you said. Now we'll talk about the vaccine policies, how all of it seems like it's crumbling around us. And we're all just kind of trying to keep our head above water to actually make that impact. And so
exactly.
one of the biggest things that I think is important, and you just said, like, how do we change this narrative, is looking at what Trump and his whole administration did when they ran for reelection. You said it beautifully. They didn't go on mainstream media. They tackled college campuses, they tackled podcasts, social media, and they went where people are actually consuming information. And honestly, that's why I wanted you on, because I said, I want to do what they're doing with my top 30 parenting podcast, because not a lot of parenting podcasts are doing this, right? And this is not about get out there and you need to vote blindly. This is exactly what you said, Maxwell, that I want people to ask questions and think about their value system. Do you
Yeah,
value healthcare? Do you value education? Do you think that people deserve it as a right? Because if you do, there's only one party right now that's unfortunately advocating for that. And that's not our fault. That's not mine and yours fault that the Democratic Party is the one who's leaning in on that. But we got to get on social media. We got to try to meet with compassion and the underlying value system. So this is something that I've changed. So when a family comes to me and they're like, I don't want to vaccinate, I used to be like, well, why are you here? Right. But now it's more like, tell me what you know. Tell me why you're concerned. And getting on their level of, I think we can both agree that we both want healthy children, right? What is the common underlying thing that we both want? I think every human being wants to be seen. And I think this is important not only as healthcare providers, but as a politician running, obviously, tell me your issue. I may not have a magic wand to fix it tomorrow, but I want you to know that I'm listening and I want to think about ways that we can make this happen so that we can improve the quality of life of all of our, patients, constituents. Like, this is what we're all trying to do. And I'm concerned. I'm glad you're on, because I feel already that you are obviously someone in this for the change. And it can become very hard to think that our politicians don't hear what we're saying. And I do believe obviously we elect you. It's important that people realize that their vote matters, and that if you want change, you got to vote for it in this country. You can't
exactly.
just think that, oh, well, yeah, people will vote. They're on, Kamala's on, Oprah and this and that. You got to get to the polls, tell people the impact, and we're seeing the repercussions of it now. It's hard to see.
Yeah, it's very hard to see. And yeah, you brought up so many points I agree with. And I think, at the end of the day, there's something I didn't bring up, which is obviously, I think, one of the catalysts for this new kind of world we live in terms of public health and the attacks on public health, which is the weaponization of COVID-19 and
Yes. Hmm.
essentially what our not just our nation but humanity went through it. And like, I talk to people about this, that especially for young people who were in school during COVID, I don't think we'll fully understand the psychological ramifications for another decade or even
Yeah.
even longer to that group of students and young people, um, in terms of just kind of what we all went through together and like the trauma associated with it. But part of it is, I think, COVID was also a spotlight on the parts of our system that don't work.
Yeah.
That
Yes.
when the rug is pulled from beneath all of us, who can still stand, who needs help to stand and who falls. And I think a lot of us saw that, wow, the way things are set up right now isn't really set up to keep all of us up.
Yeah.
And that's, I'm not here to pin that on one person. That's a system. This is part of the reason why, I believe in bold transformational change on a lot of key issue areas, because the age of, my bill will make it better for some people around the edges if you're in this income level in this year, and you'll get it in 7 years. The age of that kind of legislation, I think, is part of what has put us in this situation where the people are demanding more, because wealth inequality is so high, because the standard of living has gone down so much for so many people who are doing the things they were told that if you do all this stuff, you'll be okay. You'll be able to have
Yeah.
a good job with a good salary that'll pay for your healthcare and your food and this and that and this and that. You'll be able to send your kids to college, and you'll be able to retire with dignity. And I think a lot of people are finding, as we kick the can down the road on big issues of housing, healthcare, different things like this, people are finding, I'm not as well off, as I thought I would be,
Yeah.
or I'm not as well off as I was told I was. And I think part of what happened with COVID is, did we do everything perfect? No, we all know
Yeah.
that. We're doing, you know, and I'm not here to say there was people with malintent saying, let's do stuff to hurt people. But
Right.
I think we're doing the best we could with the information we had. Obviously, we lost over a million Americans.
Mhm.
But I do think that there's a healthy dose of skepticism into things people were told to do. And I think what the president and his allies have done very effectively is weaponize that skepticism and that trauma that humanity went through to politicize public health. And I think
Mm.
this is, I just want to make sure I named COVID, because I feel like with
Oh, yeah.
yeah, without that, we might not be having this conversation, because that was like the catalyst for this new movement we see. That's like a very dangerous thing, that I took what is, like I said, valid skepticism that people can have about things, but weaponized it into a political movement, that is going to end up killing people.
And listen, I felt the same way. I'm a pediatrician. I'm married to an ER doctor. And so obviously we saw the worst of the worst. And I'm going to say my husband saw the worst of the worst, right? So we saw the clinical ramifications of that virus, especially
Yeah,
when it first came out, right? And then we also saw the virus evolve and less people becoming hospitalized, less people being intubated. And a lot of my awareness of the pandemic was from my husband, meaning I would ask him, I'm like, hey, how's it going? He's like, yeah, we haven't had to intubate someone in like 2 months. That's a record. Or when the Omicron variant came back or the Delta variant was around, right? Oh my gosh, it's been really bad. And so you are right on that. I think the pandemic is what caused this entire shift. And it also added to that mistrust. You mentioned that you were asking some people about that mistrust in the CDC, mistrust in science communication, mistrust in doctors. And I think a huge disservice that happened is the way communication happened around the vaccines, around
yeah,
everything. And there was a lot of black and white language when we shouldn't have done black and white language. Like
you're right.
this is 100% safe. This is going to prevent you from getting COVID. We know that that vaccine has risks. Every vaccine does, right? We know this. And so that should have been the benefits outweigh the risk. The reframe of, this is 100% effective should be this is going to reduce your risk of getting the COVID virus and it can reduce your risk of hospitalization. And so when we hear that as a consumer, we're more likely to say reduction. This is not a guarantee because then what happened? People got the vaccine or they didn't, or they were forced to get it because of mandates. They still got a variant, right? They still got a breakthrough infection. Why
Yeah,
did I get this vaccine? It didn't do anything. So then it created this distrust in the communication. And so you are right that I think this current administration is monopolizing on that in the most creative of ways.
yeah,
But the ramifications, like you mentioned, are now we may be dealing with another pandemic, meaning it may not be a huge pandemic like the COVID-19 virus, but with the measles outbreaks,
yeah,
pertussis, we have seen those outbreaks come on now. And when we talk about the mandates, dropping mandates in a state like Florida that already has one of the lower vaccination rates in the country for kindergarteners, it's extremely concerning to me as a doctor here of what that's going to mean for these outbreaks in a state that is already lower vaccine rates compared to like a state like New
yeah.
Jersey, New York, California. And that's scary from a public health perspective.
No, you're 100% right. I'm really glad you brought out the way that things were communicated during COVID, because that you hit it right on the dot. Because what also happens is, because we're naturally skeptical people, and because that is an okay and valid thing, especially when it comes to the health of you and your family, when you're given that black and white language and you're told, if you question this, you're the worst person in the world, right? Kind of thing.
Right.
What happens is, and we know is, this was about harm reduction, reducing harm, and us looking at this as a team effort, right? As a nation trying to get through this thing. But when you put it in that black and white, when people see the cracks, because there are cracks, as you mentioned, with
Yeah.
everything, with every vaccine, with everything, there's nothing that's 100%. Then what happens is the blowback is even harder, because we have sold to the people that it was 100%, and when
Yeah.
it's not, then the it's just a lot worse. And I think, yeah, so I think you're right. I think decisions around communicating, I think there was a lot of bad decisions around communicating, and then obviously now we have people weaponizing it, and then kind of doing the opposite end of the spectrum, and even worse, which is going to harm people. And to go to the vaccines conversation, I think a few things, and some people might not like hearing this, but this is just the truth. Our governor wants to run for president. He is looking for opportunities to shine. And unfortunately, they've been a lot of ridiculous things that he's chosen to try to make news on. And one of them is the vaccine thing. In fact, you
Yeah.
even had Donald Trump in the White House, who's one of the leaders of this movement on mistrust on public health and medicine, say himself, well, I don't like fully, whatever he
Yeah,
said.
I remember, yeah. He was like, "Ah, that's not a good idea." And I was like, "What? I agree with you." Yes. Yeah.
Yeah,
Yeah.
and the reason why is, our
Yes.
governor DeSantis is trying to run for president.
Absolutely.
He's trying to,
Mhm.
gain that,
Undermine him.
and
Mhm. Yeah.
a lot of people don't know this, but Trump doesn't like DeSantis, so that's part of it.
Oh, yes, I knew that, and I explained that to my followers. I'm like, "Understand the intent of this this is also political, meaning his
Yeah,
response. He may believe it, but it was also like he knows that the person running that state is his political opponent." And so,
exactly.
yeah.
He does not like him at all, and
Yeah.
but DeSantis knows he needs Trump for any
Yeah.
future in the party. So either way, so this was the next thing that he picked, and we know that our Surgeon General in this state is severely underqualified, and is just not, um, is should not be in that position. And so, this effort, and so people know too, a lot of this is going to have to be done via law through the
Yeah.
legislature, because it was put into law by the legislature too. Some of it not. So we're going to have to see how this legislative session goes, to see exactly what the ramifications will be in our schools. But that, a lot of times, and this is so true in public health, is that people become complacent with something, because they didn't know how bad it was before we had that something.
Mhm.
And they don't know how good we actually have it. And vaccines is a really good example of it. And the way I like to explain it to people is, number one, children contract and give, you know, bacteria and diseases and stuff like that more than other people. Why? Because they're children. You're licking stuff and sneezing on each other.
Yeah.
This, that,
Oh, yeah.
yada yada. And before we had real childhood vaccination, in this country, people don't realize that children were dying at very, 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 very big rates. I don't want to give the wrong number here, but I believe it's 20 to 30% of all deaths were children. And now we're at a place where it's like under 1%. And the reason why is because of vaccinations and new ways that, we operate with children. And this is really important. And what people should know is, number one, obviously there's a tax on public education. This is something that would impact public education. Private schools would still be able to do their vaccine mandates, but here's the thing: it doesn't matter, because our children go to the same churches, they go to the same congregations, they go to the same parks, they go to the same theme parks. Another big thing
Yeah.
here, and
Yes,
this
for
is going to
Disney.
have a big impact on our tourism economy, because people are going to continue coming here. People are going to get sick, and then people are going to die, and then people are going to stop coming here. And it's just going to have a huge impact on all of us, not just children in public school that get sick. It's going to be a thing that impacts all of us. And I think a lot of Democrats and Republicans get that, And my hope is that we can all come together and rally against this in the legislative session, because it'll be detrimental, and kids will die. I mean, kids will die, and then adults will die. We'll see polio come back. I mean, we will see things come back that we haven't seen at that scale, and it's really scary. I mean, I was explaining to people, born and raised in Orlando. I love Florida.
Hmm.
I'm a Floridian. Obviously, we've been through a lot here, especially as a progressive Democrat. But
Yeah.
I've had people tell me, why didn't you move to California, New York, and yada yada yada? And I'm like, well, number one, this is my home,
Yeah.
and I believe in fighting for my home, and I believe in fighting where the battle is hard, and we have a hard fight here, and I'm going to be a part of it. But I gotta tell you that this vaccine announcement was the first time ever that I had a thought. The thought didn't take over and win, but I had the thought of saying, I don't know if I want to raise a family here.
Mm.
And it was that vaccine thing. But there's been a lot of
Oh,
other things I find disgusting,
wow.
but it was that thing that I was like, I don't know if I could be here my whole life and raise a family here, if this is where we're going in this state. And I know,
Well, that is the feeling I had. I have 2 children. I am a, again, physician, married to a physician, and besides that, I believe in community public health measures to protect everybody, right? And I also wanna reiterate that the vaccine mandates being dropped are for the routine school vaccines, right? So, there was never a mandate for COVID because we know that the efficacy rates and stuff for COVID wasn't great, so they didn't mandate those, right?
yeah,
Flu is also not mandated in many schools, but yes, we do mandate your Hib meningitis, your pneumococcals, your MMR, chickenpox, all the things that you get before 5 years of age. And you're right that my husband and I talked about it. We have already had plans to relocate for other reasons. And that's still probably going to happen, not because of that, but it was the final, like, him messaging me that you're right, we got to get out of here. But it wasn't the final, it wasn't like we had already planned on decision making
yeah,
happening
yeah,
before that. And then part of it was that same thing you said. I'm like, do we stay to fight the fight? But for us, like you just said, we don't have family and connection here. So we're struggling with the lack of community. And to fight any good fight, you need a good support system.
yeah,
And so that's kind of what is coming down to. But this is a hard thing for people to have to decide. We have that privilege of relocating if we don't like something. And then I think about majority of the country who relies on public health measures, don't realize what those measures will mean to them, and they can't relocate, right? They can't just up and go if they don't like a policy, or like they realize, you know what, this isn't vibing with what I want to do for raising my kids. So now it's sad to me to think that these policies are in the interest of politics. These aren't for public health. This was a political move to tout your feathers and make you seem like you're doing something big and grandiose to align yourself with your voters, but it actually is more harmful. And my question to you is, like I said, sometimes you can feel defeated. This was one of the announcements before the president did the announcement on the Tylenol, folate, autism thing, which was probably worse for me from an emotional standpoint. But before that, this announcement was very hard for me to hear because I was like, wow, like all this progress we've made trying to educate families, trying to do the good work as pediatricians, it just feels like we're failing and that everything's crumbling. So for everyone listening, does it matter to call the Congress, like call our state legislators? Like, what is the advocacy that we can
yeah.
do to encourage policies that we don't like that are coming into the voting? And like, for example, like this, like I've said call the state legislators, but of course, like how much impact does that have for things like this, or does it even?
It does have an impact. And
Mhm.
the thing I always tell people is, and it's not even about. I mean, I understand why someone would say, "Will my one call do something?" Well, you never know.
Yeah. Yeah.
But the thing about organizing is that it's never about one call. It's about thousands. It's never about one email. It's about thousands. It's about hundreds. It's, depending on what it is. And that's what organizing is all about. I love, there's this Cesar Chavez quote. Cesar Chavez, one of the most famous labor worker organizers in Arizona with the farm workers movement. Um, and he was in the middle of a hunger strike for better pay and compensation for these farm workers who were essentially doing slave labor. They were all immigrants from all around the world. He was in the middle of this hunger strike, and the people were getting discouraged. The workers, they weren't getting what they needed, and he said this famous quote. We know it's yes we can, and but that actually yes we can from Obama actually came from Cesar Chavez and Dolores Huerta when they said in Arizona "si se puede," right, in Spanish. But there's something Cesar Chavez would always say, which is organizing is simple. You talk to one person, and then another person, and then another person. And that's what this work is all about. And so people ask me, is calling an office, emailing an office, sending a message to offices an important? 100% yes.
Yeah.
Because a lot of people haven't been in a legislative office before. They're not that big. And when you are flooding that office with calls and emails and letters and stuff, you're actually kind of changing the physical environment of that office.
Mm.
Like the I don't have a better word for it, so I'm going to say the vibe. The vibe of the office shifts because what you're doing is you're exerting pressure on an elected official in a place that they're working in where their staff is at, and that helps.
Yeah.
Will I say that changes everything all at once? No, but it's a tactic that you use, and then you go to the town hall, and you don't go by yourself because one person standing up is important and is powerful, but what's better than one person is 50.
Yeah.
You show up with people, you go to that town hall. If they're not hosting town halls, because there's a lot of my colleagues not hosting town halls because they're being yelled at,
Yeah.
then maybe you find out where they're going and you go up and you speak to them, right? And you
Yeah.
go up with 20 people and you speak with them. Hey, I know you're not hosting town halls, but we want to talk to you about this vaccine thing. I'm here with Democrats and Republicans. I'm here with independents. I'm here with families. We want to talk to you about this. We're worried about it. And exerting that pressure helps because when that person goes to Tallahassee or Washington, D.C., or your local city council to make that decision, um, you have made your voice heard in a way that's undeniable.
Yeah.
And I think that that's really important. They won't always do what you ask for. And I've been involved in politics since I was 15 years old after the Sandy Hook shooting. I've sat in an office with countless politicians who've cried with me, who have cried with survivors of gun violence, who have cried with family members who just had their little sister shot to bits in school. I've had politicians cry with us and hug us and say, we're going to do everything we can. And then the
Yeah.
next day they go in and vote the same way they've always voted. So I'm not going to sit here and lie to people and say, if you do it, it'll change everything. But what you're doing is you're building power and you can change it. And if you don't do anything, you won't. And I think a good thing about this vaccine fight is it's bipartisan. There's
Mhm.
Republicans and Democrats and independents of the people who understand that we can't go down this road. And you got to make your voice heard. If you can go to Tallahassee, right? Like, if you can speak with your elected official locally, speak with your elected official locally. If you can host a protest or a demonstration, do that. If you can host a healthcare town hall with Democrats and Republicans and invite your local elected, and if they don't come, put a cardboard cutout of them there and invite the press. Do it, right? Do what you can to ratchet up pressure so they understand that as you make this decision, we are watching. And not only are we watching, but we have told you what we believe you should do. And to be honest, so this is not breaking news, but in many cases, that politician already agrees with you. But
Yeah.
they don't have the courage to stand up for what they actually believe in. And so they will bow to the bigger political pressures in their pursuit for political power. And they're more afraid of someone else than they are of their constituents. So you got to show them that you have the courage to go out and speak to them because courage is contagious. I do believe that.
I love that. And, I'm curious your thoughts. Obviously, this is your own personal perception. Do you think that the age has something to do with it, right? These people, like, you're a younger congressman. Obviously, I think at the time of this recording, you're 28 years old.
Yeah.
And the average age in the House is like in the 50s, Senate, it's closer to 60s. Do you think that the younger generation, the generation that Gen Z always gets labeled as lazy or, too emotional, but you also are the generation that also asks a lot more why and doesn't take no for an answer. And Brene Brown is a wonderful speaker. She talked about that. She's like, Gen Z is doing something that a lot of our generations before were like, because I said so. And do you think that the fact that you guys, as a new generation, having younger politicians, younger change makers, do you think it'll change that tide where they actually vote with what they feel versus that influence from other higher powered individuals, or why is that happening? Like, why can't
Yeah.
they just say, you know what, I'm going to do this because it's what's right?
I do think generally Gen Z is a generation that's very entrepreneurial, that is always
Hmm.
asking questions, and that, yeah, when people say the lazy thing, I'm always like, I don't see that. I mean, all the
Yeah,
social
I don't see it either. Yeah.
yeah, all the social movements I've been a part of, if anything, the entrepreneurial thing sometimes isn't great, because like Gen Z loves to start their own thing,
Yeah.
like do their like start something and do something and be active. And I think it's really cool. I actually was speaking with some friends about how the similarities between Gen Z and actually the baby boomers in
Hmm.
in a lot of traumatic things and points of connection with our generations growing up, and what it'll look like as we get into power. I'm very interested to see. But when you ask people about what's a moments in your life that you feel like your whole generation could empathize with, a lot of boomers will bring up a lot of war, and a lot of
Yeah.
forced to go to war, and or sorry, seeing their parents being forced to go to war, and for us, there's a similar thing right now. And also, when I asked for like what are moments you think all Gen Z remembers, I hear the Parkland shooting. I
Yeah.
hear George Floyd. I hear all this stuff about death, 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 and it's very traumatic. So, the other thing I have to say is the forces of big money, big corporate money, um, big political forces will continue to be omnipresent in our political system, and will have outsized power in our political system unless we do something about it. And I'm not under the impression that just because someone is younger means they're not corruptible. And
Right. Great point.
and so I think it is important to have younger people in office, but there's a lot of times the type of people who run for political office are people who have a lot of ambition, but not a lot of passion.
Mm.
And you need ambition. I'm an ambitious person. You're an ambitious. We need ambitious people. But with the lack of real passion that is, connected to people that you're serving, that's where you can be corrupted. And yeah, I'm not under the impression at all that it'll just go away as a new generation takes hold, um, unless that new generation changes the way the system works. Because
Mm.
the fact of the matter is, we're human, and we will feel those pulls and those tugs, and some of us will resist it better than others. This isn't excusing corruption, but it's just a fact. But what we actually have to do is have the courage to cut it off and say that we're going to cut that tug as much as we can, to make sure the only people who can tug at us are the people we represent in our district, and that big dark money and that huge corporate interests can tell us what they think like everyone else, but don't have so much power where it outdoes everything else. And that's the way the system works right now. So that's when we talk about things like Citizens United and election reform and getting big money out of politics. All this stuff is so important. There shouldn't be like one billionaire who can say, I don't like you, so I'm going to throw $50 million against you. And 98% of congressional candidates that win their race had the most money. Right.
Yeah.
So
Yeah.
yeah, either way, not to go on my system rant, but the thing that polls the best with Democrats, Republicans, Independents alike is that our system has a lot of corruption in it, and we have to have the courage to root it out, no matter who's in office. Because what happens is, if your person's in office, you're like, well, nothing's corrupt, we're all good. And then when the other person's in office, you're like,
All of
oh,
a
it's
sudden,
all corrupt. Yeah, and we
yeah,
have to be able to say that there is corruption in both parties. We have to be able to say that there's big money corporate interests in both parties.
absolutely.
But at the same time, being real about the fact that there's one party destroying public health and there's one party trying to save it. We can say all these things at the same time, um, and hopefully do something about it.
Oh, I resonate with that. The ambition and passion thing I think exists in so many different aspects, not just in politics. I mean, I
Yes.
know clinicians as well, right? That have the ambition, but they have lost the passion or really never had the passion to help. And then that's when they're going to fall into more corrupt practices, insurance fraud, things like that to make the bottom line versus actually helping individuals. So what you said is valid across many different, areas, I believe. And I can resonate that being a healthcare, in the healthcare world. And it's sad. We go back to the education system and the healthcare system, and
Yeah.
how a lot of it is corporate America, a lot of it is capitalism. It sounds like politics is obviously very highly influenced by the money you have, and capitalism as well. And we see that in healthcare, and it's okay to say that. Like,
Yeah.
I love being a pediatrician. I think I'm a really good pediatrician. I know I have a lot to learn still, even though I've been practicing for 10 years. That's the growth mindset that I have. I also know the ways it benefits the world to be in a modern healthcare system, but I also know where there's pitfalls, like we mentioned earlier, the low visit times, the lack of reimbursement, insurance companies being involved. So to go back to I think your through line that has really stuck with me is the desire and okay to ask the why, but still be in the mindset of like, what is the evidence? What can we actually do to change? But it's okay to question these things. But what's not okay is to hurt other people in the process, to spread misinformation, to, what has happened a lot besides the pandemic is the division that we've seen from our president. And I don't one of the biggest things I have a problem with this administration is the divisiveness that's being created at public forums, right? We're talking about, I get it, we're going to be divisive, but I've watched debates when I was a young kid between, again, Republicans and Democrats, and there was cordiality in there. Even though they didn't agree on policy, there was like, thanks, Barack, or thanks, John McCain, right? Thank you so much. And then they would go. Now it's just like name calling and anger. And we've almost, in this culture of America, have made anger an okay feeling to have. And that
Mhm.
is just ripping all of us apart. We can't even have conversations about these policies, right? That on social media or on, in you said like your like peers in your life, like we should be able to have cordial conversations about the importance of these value systems and why we are voting as we are, and listen to facts. But people just shut down when when it's not something that they agree with. And that I think has gotten so much worse in the last 7-8 years,
Yeah.
especially with Donald Trump in the office. He's made it
Yeah.
okay to be angry, and he's made it okay to be a hateful person. And that, to me, hate and anger has always been a human emotion, but he's normalized it, where it's okay to be offensive towards people with disabilities. It's okay to be racist. It's okay to just say that I don't like you and I'm not going to agree with you and that you're a horrible person. It's okay to go to the UN and say things that are harmful to other countries. And again, it comes from a very unhealthy place that divides instead of brings us together. And I think you sound like that person that wants to bring people together, whether they're voting red, blue, whatever. And I'm the same way. I want people to be raising healthy kids. I want people to know the facts and know the science. And I don't want us to argue about things because life is too short and people will die like if we keep doing this.
No, 100%. I mean, I think Donald Trump's introduction into national politics has brought out the worst in everybody in this country, and and I can't wait for that to be hopefully
It's
over.
hard.
Um,
Hmm.
but um, yeah, what you said at the end is exactly what my politics are about. I mean, when I'm in a rush, I always tell people like, look, my politics are simple. Like, I want you to live your best life, and I believe being in the richest country on the face of the earth, our government can do a better job
Yeah.
of making sure that there is a line that we set, and we say as a government and as a people that because our country has immense wealth, our country has immense wealth. We're such a large economy. We have so many resources, but we have to look at the way we prioritize things because we can, as a society, come together and say, this is our line. And we're going to say that no American will get below that line. And what's below
Yeah.
that line? Homelessness, abject poverty, being hungry, not being healthy. And it really takes political will for us to come together and say we're going to step aside. We know that we have that some of the most wealthy people in this country. And I always have to explain to people, I'm not talking about your billionaires or your 100 millionaires. I'm talking about the 1.1% of people, billionaires and these huge corporations that really profit off of someone like Donald Trump making us believe that the reason we can't pay our rent has to do with our neighbor that might be trans or an immigrant or something.
Right. Right.
When we have more in common with other working people who our bank accounts look a lot more similar,
Yeah.
and a lot of people don't realize that we are closer, all of us are closer to living on the streets than being like Elon Musk, right? Having a bank account like
Yeah.
that. And I explain to people because they want us looking around at someone to blame instead of looking up. And that's part of the issue. And it's not on this like, and I guess I am a populist, but it's not on this like faux fake us versus them mentality to rally you up and then nothing happens. But it's like real. Like we have real system issues in this country that obviously not working for the majority of us, whether you're Democrat, Republican, or whoever. So the question is, how do we fix it? And it's easier to run on a agenda saying, I don't like the federal government, we're going to destroy it. It's easier to destroy something than build something. That's why very right wing governments, they are oftentimes able to get through stuff quicker because it's easier to just destroy stuff than it is to try to build a system, a new way for us to take care of not just our most vulnerable people, but all of us. And I hear this all the
Yeah.
time. People are like, "Yeah, Republicans take care of the top 10%, Democrats take care of the bottom 10%." And I'm like somewhere in there, and like I feel like no one's looking at me. And I grew up like this. I grew up middle class. My mom's a teacher, my dad's a musician,
Mhm.
and we grew up in the household where you feel too rich to be poor and too poor to be rich.
Mhm.
And
That was us. Mhm.
yeah, and
Yeah.
you need help, but you don't qualify for anything because you're not that bad off. But then you don't have the money to really send your kids to the college they want to go to and all this. And now you can't pay for food anymore, right? I talk with my local food banks and they're like, we're at over COVID levels. And 20 years ago, the breadline would be people in abject poverty and people who are homeless. And now it's mom and dad pulling up in the minivan, pick up the kids from school. They both have good jobs and they can't pay for anything anymore because we've been siphoned from for
Yeah.
so long. And it's at this breaking point. You know, not to use buzzwords and stuff, but I do believe Donald Trump is someone who's an authoritarian. And
Yeah.
people like this, authoritarians do not come to power when everyone's doing good. You know,
Right.
it just doesn't happen. It happens when there's a deep anxiety. That's why I really try not to belittle people on their vote, even if they voted for. I'm on this town hall tour with Chris Murphy, Senator Chris Murphy. We're going to red districts and talking to people, and
Amazing.
I'm on Blue Sky too and stuff like that. But some of the problems I see on a lot of these very democratic spaces is you hear a lot of like, "I told you so," right? I remember, we know a lot of Latinos voted for Trump. We have this, horrible deportation campaign going on, and then I would have people I know even be like, "Well, they voted for it." Like politics is about addition, not subtraction.
Mhm.
And I don't know. I'm one of these people that think like be have grace with people and be ruthless towards systems, and that's my politics. I'm uh, I'm not going to shame someone for a decision they made. I'm more worried about the next decision you make. And I hope that my conversation with you, or my event that I had, will play a part in us coming together around real solutions for this country that are big, bold, transformational change for working people and not just like selling a pipe dream and then destroying the country that we're in. So that's what
I
I'm about. And in the public health part of things, I think we have a lot more learning and education to do on things. I think that there's just, I consume a lot of like public health content creator stuff, and I actually watched that one of these videos where it's like a bunch of people debating against each other or something. It was the anti-vaxxers versus someone or something like that.
Mhm.
But something I kept hearing a lot of was, people saying, "Well, I've done research and this and that." And it's even explaining to people that no, well, I mean, you probably didn't do research, but you probably looked up research other people did.
Right.
And the reason I think that's important is not to belittle people, right? But so people understand that research and this work is like real, that people have put blood, sweat, and tears into to provide you with analysis and information on the research that they did. And it's there on the internet for us to look up. And even small things like that I think are important because it puts in perspective a different level of work that was done to tell us why professionals think this is what we should do. And I think there's just so much distrust in that that someone Googling something will tell you, oh, I've done a lot of research, and they'll tell that to someone who's done like actual research. And I think this is part of the issue that we're in, where like it's like cool to be against learning things.
Right.
I think.
Right.
Yeah, but I'm rambling on now, but thanks
I
for having me
listen,
on.
I love your rambling, and I also just wanna thank you because throughout this entire conversation, it was just refreshing to see you be as an elected official with the mindset that you have, right? And also, because you're younger, it's even more refreshing because I don't know what your future in politics is. I'm not gonna sit here and ask you what your ambitions are in politics, but I hope that you continue to go on, continue to succeed in whatever position you want to run for because the mindset and the value system that you carry is very refreshing to see. And I got a little teary eyed because it's easy to feel defeated and disillusioned and that things are not going to change. So, my final question for you is for people who are listening who maybe feel powerless or disillusioned by the political system, feel like, where are we? What are we doing? How do you get through it as a politician, as a young man in America? And what would you say to those listeners today?
um, Honestly, being in community is how I get through it, like being with other people. We've talked about this earlier,
Yeah.
and I always have to go back before I was a politician because, like I mentioned, I've been involved in politics since I was 15 years old, all on gun violence. That's really all I worked on for a long time, um, for about like a decade, and that's a movement that's really traumatic.
Yeah.
It's a movement where the time when the news is talking about it and people are donating and people are caring is directly connected to more people dying.
Yeah.
And there's many times throughout my life that I was like, I'm done. I'm gonna focus on my music, right? I went to art school. I'm a musician, so I was like, many times I was like, I think I'm just gonna focus in on the music. But then I'd go to the event I had scheduled that night, or I'd go to the hangout with other organizers that I went to, and I would be reminded about the reason I do this work. And it's not. I mean, it is like for the outcome that we want, which is a more just, safer world. But the people around you really keep you going because we all go through this. We all go through moments where we feel like all hope is lost. But something that I keep going back to after being in this fight for 10 for about over a little over a decade now is that I've had a lot of moments where I felt like it was over. But now I'm here.
Yeah.
And I keep telling myself this because it's going to be the same in 5 years when I look back. That's not to downplay the real threats to our democracy going on, and the fact that if we all don't step up as a society and politicians don't step up, that we might be in a place where there's not much left to defend. Um, but I have faith that we will be successful in being able to push back and get not just get back to where it was, but get back to a better place for people. And that kind of fierce, radical optimism, I think, is very necessary, especially living in the United States of America.
Yeah.
And and it is ingrained in what it means to be an American. I just think about all different times in our country's history, um, violence, hatred, bigotry. And I think to the people who were in my position way back then, not just position in Congress, but like person part of this struggle. And if they didn't do what they did, I wouldn't be here. And chances are there's going to be two people having a very similar conversation than what we're having in 100 years that'll say something about us. And for me, it's not just about like, I want to leave my legacy. I don't really care
Mhm.
like about that kind of stuff. It's not really what matters to me, but like the outcome is really important. And I'm just really honored to play a very small part in a really big struggle. And but being with other people is really what keeps me going.
I'm honored to know you. I'm honored to connect with you. I mean, I hope that you know that you just said something that brings me the joy when I'm feeling defeated creating content, right? When I'm watching press conferences and I'm like, oh my God, I take myself out of it. I focus on my mental health and then I create. My life is a life of purpose. I find so much joy from helping others. I also take care of myself in the process, which I hope you do as well, being a helper in this world and trying to make change. But it is nice to when you go back to that community, to the why, to the purpose. And I think, I feel that, and I said it already that I'm glad that you're on my show. I'm glad that the world who listens to my show, whether they're in America or internationally, because I have international followers, know that not all hope is lost, that America is not going down the toilet. After Trump's press conference on Tylenol, autism, and a lot of the misinformation there, I cried. And my husband came home and I was like, this is horrible. And he's like, is it really horrible? And I said, what do you mean? He's like, Mona, every generation has dealt with something that we talk about in history books, slavery, civil war, all these things are happening and this is our thing. And he's like, maybe we're going to come back stronger. I have no doubt, that we will. And I'm like, wow. Thank you for bringing this positivity today because normally you're a little bit of a pessimist. He's like, this is hard, but I know we're going to get through it. And he's like, you also now have content to talk about. And I'm like, you're right. I mean, he's like, use your platform to share the advocacy like you are, right? You have your social media. Thank you for coming on your very busy day to talk to me because now we're going to spread this information. People are going to share it. And I just want to thank you for your time.
Yeah, thank you so much for having me on.
And where can people go to stay connected? Your social
Yeah,
media handles, website, all of that.
yeah, people can go to at Maxwell Frost FL. I also have an official account, which is at Rep Maxwell Frost.
Wonderful. I will be adding all of that to the show notes, everybody. Please make sure you follow just to get motivated. If you're feeling disillusioned, you feel like what's going to happen, just follow even if Maxwell Frost is not representing your district. It's important to know that these change makers exist. And if you like this episode, share it, subscribe, make sure more people hear it. And that's how we can change this country and change the world. Thanks for tuning in. And again, thank you so much, Maxwell, for joining me today.